Hi there, I'm Mike Lindsey. Welcome to the Pacific Northwest, and today we're going to be talking about hemorrhoids. You see,
No,
hemorrhoids...
I think it's hemorrhage.
Oh, well, hemorrhaging is a part of having a hemorrhoid, because you see what happens.
Like tourniquets and bleeding.
Well, putting a tourniquet on a hemorrhoid would be very difficult.
I think it's hemorrhage.
Oh, that's awkward. All right, yeah, let's start this over. Hi there, I'm Mike Lindsey. Welcome to the Pacific Northwest, and today we're going to be talking about hemorrhaging. Specifically, we're going to be talking about ways to stop hemorrhaging. Now, the ways that we're going to do that, we're going to be applying pressure bandages, elevation, and finally tourniquets. And we're going to wrap up with some common mistakes that I see people make. Stopping hemorrhage by using pressure is the most effective means and the most common means which you're going to use. So we have a cut here, and we're going to stop it by taking a gauze and simply putting pressure with the gauze using our fingers. Now, notice I'm wearing gloves. If you're doing it on someone you don't know, you should be wearing gloves. Never do this with bare hands if you can avoid it. So, basically, you're going to put pressure directly on the wound. If you see that the bleeding is soaking through the wound, well, you're going to add more gauze and possibly more pressure because your pressure is not effective enough. Use of a pressure banding is great in situations where you're not able to hold the wound with direct pressure using a hand for long periods of time, say in an evacuation type situation. So what you're going to do is you're going to use the bandage itself to apply the pressure. This can be placed on extremity or on other parts of the body, including the head. So we have a cut here. What we're going to do is we're going to take a bulky dressing and we're going to wrap it. But as we're wrapping it, we are applying pressure, keeping pressure on the bandage. We're not trying to necessarily cut off the circulation. This is not a tourniquet, but we are keeping the dressing taut as we apply it. Use of an elastic bandage, such as an ACE bandage or other brands, can help in applying the pressure bandage. If you see that you have blood soaking through your pressure bandage may not be tight enough, or it may be covering too wide an area and is not focal enough over the area that needs the direct pressure. If you see that it's soaking through, try to add more pressure if possible, and possibly add more dressing. Another method for controlling hemorrhaging is to elevate the area that is hemorrhaging. Specifically, what you're attempting to do is elevate the injured area above the level of the heart. Here we have an injured leg. Using a backpack propped up, we have the injured extremity raised above the level of the heart, helping to control the hemorrhage. Now let's talk about tourniquets. When should a tourniquet be used? Well, a tourniquet should be used for any life-threatening bleeding. Generally, this is going to be arterial bleeding, which will be bright red and spurting, though a tourniquet should be used for any life-threatening hemorrhage that does not respond to direct pressure. There are a couple different types of tourniquet, in that there are the commercially available type, and then there's the makeshift type. Now, commercially available is much more preferred method of stopping life-threatening bleeding, as it is much more effective, though we will talk about makeshift tourniquets. Most commercially available tourniquets have a similar design. They'll come in different colors, but a similar design. This is the band. The band has a Velcro strap on it. This is the windlass. It's used for tightening up the tourniquet. And this, finally, is the clip. This is used for holding the windlass in place. So I'm going to demonstrate putting this tourniquet on myself. Now, the tourniquet should be placed proximal to the life-threatening hemorrhage. In this situation, we'll say that I have a life-threatening hemorrhage just above my knee, about there. We're going to move it proximal. Now, proximal in this situation would be between my wound and my heart, because once again, it's likely to be arterial bleeding, and we want to stop that arterial blood flow. So we're going to place it around a few inches above our wound, and we're going to tighten this down with the Velcro strap. Put the Velcro all the way around, make sure it's secured. Then we are going to take our windlass and tighten it until the hemorrhage has stopped. You place the windlass into the clip and then close the clip. Notice that there's a spot for time here. You do want to write the time. The reason for this is because nothing more distal to my wound is receiving blood. Therefore, it is undergoing a hypoxic or ischemic injury from lack of blood flow. So having the time is important, as the provider, the rescuer that will take care, will know how long the tourniquet has been in place. In a situation where the patient cannot or may become obtunded or unconscious, it is actually important to write the time on the patient's forehead. You write TK followed by the time. The reason for this is because, say you have a black tourniquet on top of black pants, the patient is unconscious and they can no longer tell you about their tourniquet. They can no longer say, my leg hurts. So it is important that a rescuer and an attended patient know that they have a tourniquet and know when it's placed. Additionally, when it comes to tourniquets, they're designed for combat, meaning that tourniquets can be used with one hand if necessary. It's a bit awkward, but it can be done. So for this example, I'm going to place it on my left arm and do everything with just my right arm. The clip out, we tighten the windlass. As I said, a bit more awkward. And the clip, placed down, secured. In order to make a makeshift tourniquet, what you're going to do is you're going to take some fabric. You're going to then wrap the fabric proximal to the wound. Our wound is there. We are moving up the leg because we are trying to stop arterial bleeding. So we move the fabric up the leg, proximal. We wrap it around several times. Our goal is to have something around 3 to 4 inches thick. You do not want something thin. You do not want a wire, a small string, anything like that, because once you tighten those down, they will cut into the skin. That is the opposite of what we want to do. Now, once we have something wrapped around several times, this is a Curlax bandage wrapped several times around. We're going to take some sort of rod, stick. Here I have a trekking pole, and we're going to start spinning it. And by spinning it, we are going to apply gradual pressure until we reach a point that we have stopped the bleeding from this wound. So once we have reached the point where we have stopped the bleeding, what we are going to do is we are going to secure it in place. Now, if you had another bandage, you could wrap it around and secure it in place. Here I have some tape, which I'm going to try to take out, and I'm actually going to tape it into place. Therefore, this keeps the stick from unwinding and releasing the pressure on our wound. Well, I hope you enjoy learning how to stop hemorrhage. I'm going to finish up with 4 final points. Point 1, you do have other tools at your disposal. Disposal. One of these tools, combat gauze, or quick clot. What this is a gauze impregnated with something called kaolin. This is a chemical which starts hemostasis. Essentially, it's going to help you clot. It's going to help the body clot more easily. You're going to take it out of the package, place it onto the hemorrhaging area, and then place additional gauze on top of it. You do not need to take it off. Just leave it on there until you get them to definitive care. Second point, if you have a wound that is gaping and you're having trouble controlling the hemorrhage, what you should do is pack the wound. I mean, take gauze, pack it inside that wound, and then place additional gauze on top of it. That's going to help you achieve hemostasis. Third point, one of the most common reasons that I see why someone fails to stop hemorrhage is what I call the peekaboo. No peekabooing. So what that is someone places a gauze on the wound and they hold it on there a few moments and they want to see if it started working already. So they take a little peekaboo. Well, every time they do that, they're essentially removing that clot that has formed. That is detrimental to the goal of what you're trying to achieve. I would say there is no reason to look in most situations at the wound in the first 5 minutes. Leave it on there a good 5 minutes or longer before you do your first peekaboo. And once again, you don't even need to do peekaboo most of the time. If you see that after 5 minutes that it's still bleeding, I would leave it on for an additional 5 minutes. So leave it on for 10 minutes and then continue that trend. Fourth and final point I'm going to make is one of the other common most reasons I see for failure is because the pressure is not direct. I don't mean that there is not enough pressure applied. I mean that it's applied across a greater area that is necessary. Often, as an emergency physician, I will see wounds that come in and there is a huge blood-soaked gauze on top of the wound. I'll pull the gauze down only to see a small little laceration. And that's the failure of that is because they're putting pressure across a large area when they have a small wound. In that situation, take a small gauze, place it over there, use 1 or 2 fingers, place it directly on there. You don't have to place a whole hand. It's more effective putting direct pressure on the area that is bleeding more specifically, we'll say. And that concludes this video. I hope you enjoyed it, and I hope you're ready for your next Quentin Tarantino bloodbath.